Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms, and welcome back to Every Mom is an Athlete. We are on part 4 of our pregnancy pain series. And today we're going to talk about one of my favorite things to help people with, whether it's in my office or online, is low back pain, okay, during pregnancy, or pelvic girdle pain, okay? We're going to lump those two together today because they're both really addressing some sort of issue with the low back or the pelvis. And you've heard me say it before, but I'll say it again. While low back pain, pelvic girdle pain is common, it is not normal. So you don't just have to accept like, oh, I'm pregnant. This is something I have to deal with. That's not necessarily true. There's a lot that we can do to help with this issue. And that's what we're going to walk through today. Now, there's a lot of reasons why women get pelvic girdle pain, low back pain. Let's just call it low back pain, okay? Pelvic girdle, like saying that 10 times fast is tough. So we're going to call it low back pain. But you understand I'm either talking about pain in like the lumbar spine, which is the very lowest part, kind of like that small of your back, or into your pelvis, which is kind of your hip bones, and then all the way around, actually also your pubic bone too. That's the front of your pelvis. So there's a lot of different reasons. The first one is relaxin, right? We know as soon as we get pregnant, actually many women don't know, but in the first trimester is when relaxin is highest in your body. So that can kind of mess with you a little bit because even though you don't necessarily look pregnant, your body is changing so much. The joints are already loosening. Everything is changing hormonally. And so that can be a time when people are like, I don't understand. Like, why does my back hurt? I don't have a big belly yet. I hardly even look pregnant. And that's why, because of these hormonal changes. As you go along in pregnancy, obviously, then we start to look at the change in mass, right? Your center of mass is definitely changing. Your pelvis normally tilts forward a little bit as that belly pulls it forward. So that can cause some stress and strain in your low back. It can jam those joints together, especially if you're not focusing on doing some core work to stabilize and try to keep things a little bit more neutral. That can also happen. Also, your hip flexors are going to tighten up then. And so this comes with a combo of things, right? Maybe you're not working out as much as you used to because maybe you're exhausted or you're sick or like, a multitude of reasons. Maybe you're sitting a little bit more. All those are reasons that kind of can snowball on each other to why some women end up with more pain in their back during pregnancy. But this is where I like to make sure that women know, again, there's so much we can do, right? Like, don't accept your doctor's answer of like, oh, it's just relaxin, it's just pregnancy, this is just what happens. Like, no, that is not just true. There are experts out there like me, like pelvic floor PTs, even some amazing strength coaches or pregnancy fitness experts that can help with a lot of this stuff. So what does this feel like? Obviously, if you're listening to this episode, you probably are having some of these issues, but this could be just a dull ache in the back. This could be tightness that you're feeling in the back, in the hips, in your glutes. This could be sharp pain in your SI joints. So that's along the back. You have those two little dimples in your back. That's where basically the two bones of your hips are. And then your sacrum is right in the middle there. It could be pain along there. This could look like pain with single leg movements or with rolling over in bed. That's one I hear a lot. And again, this isn't just necessarily due to weakness. It's not due to just the hormonal changes. It's also an issue of like learning how to breathe, learning how to brace, making sure that our pelvis is aligned. There's just so many pieces. So let's talk about what we do if we're having some of these symptoms and we're feeling some of these issues during pregnancy. So what can we do here? You might guess that one of my first answers is if you're having severe pain, obviously you need to talk to your doctor about that, okay? You need to make sure they know, make sure they can rule out that there's not anything more serious going on. Then you need to find another type of doctor or provider that can help you. So that might be, I always recommend a Webster certified chiropractor like myself. That might be a pelvic floor physical therapist. That might be even a massage therapist who's really educated in pregnancy massage. They can be super helpful in alleviating some of those symptoms. But there are so many providers out there that can help with this. One thing that I find with a lot of pregnant patients is, and honestly, with a lot of patients in general that come in to see me, is, both of your hips and both of your SI joints, they move individually. So one side of your hip, if you've ever been to a chiropractor and they've been like, oh, your your pelvis is rotated forward or one of your legs is a little bit longer. Sometimes that's anatomical. Like most of us have one leg that's just a little bit longer, but lots of times it's coming from that hip being rotated forward. So you can imagine if one hip is rotated forward a little bit, the other side is rotated back a little bit, that's going to really throw off your pelvis. And if you listen to any of these other episodes, I've talked about this, but that's why getting in to see a Webster certified chiropractor can be so helpful, because not only are you going to get those hips aligned, which will help decrease pain, but it also creates better room for the baby to get into a good position eventually, right? Like you can imagine if those hips are really rotated, then it might be hard for baby to get in a head down position. They might be kind of oblique. So if you're not able to get into someone to help align your hips for whatever reason, like where you are or insurance purposes, or there's just not anyone you can see that you trust, I do have a plan called the Pelvic Pain Fix. Pelvic Pain Fix, say that 10 times fast. But what I do in that plan is walk you through all of these pregnancy issues. And then I say, hey, okay, if you're feeling this, this, and this, here's what you need to do. Here's how you can actually realign your hips at home. Then here's some mobility work. Here's some strengthening work for each specific thing. So low back pain, there's one for sciatica, there's one for round ligament pain, all those things. So definitely check that out if you need further help. The next thing a lot of people start with after they make sure the alignment of their pelvis is good is to start low back strengthening, okay? And the reason is, if you think about it, as everything is loosening up, the ligaments, the tendons, everything's starting to move, the only thing that you have are your muscles to really stabilize things. So we can do a lot of strengthening around the low back, around the hips, and it's sort of counterintuitive. It's like, well, it like kind of hurts. You want me to use the muscles? Yes, I want you to use the muscles because that is what's going to stabilize things and make your body feel a little bit more secure, stable, and that can really decrease the pain. So what does that look like? Low back holds early on if you're still in your first trimester, you can get down on the floor, you can do a Superman. Later on, I actually have people at the gym do a low back hold either on a back extension bench or using like a yoga ball. And so that you're actually in a little bit of extension using those low back muscles. You can get a similar effect from like some good mornings or like a banded hip thrust or glute bridges. Those are all things that are going to work that posterior chain, but specifically we want to work the low back. There's only a few ways that we can do that, right? Especially as the belly gets bigger, we can't be on the floor on our tummy. So those are some ideas as far as how to strengthen the low back. Also, I have patients focus on the hips. So you want to do things where you're using the lateral hip muscles. So that could look like banded squats, banded monster walks, or like lateral steps with the band, clamshells. Those are just like a few that come to mind first thing. But again, that's going to help stabilize your hips and that can decrease a lot of your low back pain. Now, one thing I see a lot of women do that I'm going to highly advise you not do is overstretch. Okay, again, I feel like I'm like beating this to death, but your ligaments, tendons, everything is already more mobile than normal. So stretching and like cranking on these areas is not going to feel good and will usually aggravate things. So when I have people come in like, I've been stretching my hamstrings, I've been stretching my hips and like it's getting worse. I'm like, yeah, of course it is. So what I'll have you do is either do like more of a dynamic stretch. So where you're like not bringing the muscle to end range and you're really focusing on moving the joint, or foam rolling, because then you can get in there really more specific to certain areas that are tight and then leave alone the areas that are already too mobile or already fine, right? Those are two things as far as mobility that can help without aggravating whatever symptoms you're having. Of course, what kind of pregnancy and postpartum chiropractor and expert would I be if I didn't talk a little bit about breathing here, okay? It sounds so boring, but breathing actually does a lot for us in general, right? Obviously, we have to breathe, but it can regulate our nervous system. And also, you have to think about our diaphragm. So that's our main breathing muscle, right? It is right underneath our ribs, okay? And it's essentially the top of our core, quote unquote, okay? So you have your pelvic floor, and then parallel to that, right above, like right under those ribs, like I said, is your diaphragm. And those work together. And as your belly gets bigger during the pregnancy, it's going to get more and more crammed up there. And so this is where people stop getting that full expansion of the diaphragm, which can cause low back pain, can cause some rib pain, also can cause some neck pain because then we start using these accessory muscles up in our neck to breathe instead of the main big breathing muscle that we're supposed to use. And so really focusing on that 360 breathing. So all the way around, I have my patients really focus on like laterally expanding their ribs. So if you put your hands on your ribs, like on the sides of your body, and then really try to like expand out that way instead of just out through the belly. That will just help you expand all the way around instead of just out, like I said, right out into the front. That's sort of the difference between belly breathing and 360 breathing. We want to do 360 breathing, especially during pregnancy, because we don't want to be putting so much more strain right through the center of our tummy out front. We want to be breathing all the way around. And sometimes people will report to me that this like hurts a little bit at first. And what I always say is give it a few breaths, like do 4 or 5 breaths and then determine how it feels. Because lots of times your ribs are expanding for the first time in a while. And it can be like a little bit like, oh gosh, that's uncomfortable. But if you keep doing a few more breaths, it'll often start to actually alleviate some of your discomfort. So don't just like do 1 or 2 and be like, oh, that doesn't feel good. Like at least give it 3, 4, 5 breaths to make sure that like, okay, now I can actually feel my ribs expanding. And even though there's a little discomfort, like I know it's good. And after, usually you'll feel much better. Other things I get questions a lot about are modifications, right? So if you are having low back pain with certain movements, you can modify those. So let's think. One, for example, that I hear a lot is squats, right? Like, so naturally at the bottom of a squat, your pelvis is supposed to tuck under. So like your tail kind of tucks, right? At the very, 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 very bottom of the squat. But what happens is this, because of like tightness and the way that your belly is kind of pulling forward, this will start to happen like higher up in the squat. What some women will experience is they start to get sort of tailbone pain or pain around the SI joints with squats. So what I usually have people do here is make some modifications, right? Get a bench, squat to that bench and bring it up above 90 degrees. So if you're used to squatting all the way down, as far as deep as you can, bring that up, and that's going to cause less rotation in your pelvis. It'll allow you to just keep things a little bit more stable. It's super important to be squatting during pregnancy because if you think about it, the way that we give birth, whether you're squatting, right, or on hands and knees or on your side or even on your back, which by the way is anatomically the worst way to give birth because it closes down your pelvis. I'm not saying don't do it. I'm just saying like do a little research because it actually is like the smallest hole the baby could come out of in that position. But any of those ways, you need to be comfortable in a squat, right? So I always try to have women squat all the way to the end of their pregnancy. We're trying to get really comfortable in the bottom of that squat position. So there are lots of ways we can modify squatting so that you can continue doing it, even if it bothers you, initially. I also get a lot of questions about belly bands and if you're having pubic bone pain, I should say, go back and listen to the pubic symphysis dysfunction episode because I do talk about the Sorolla belt and having that SI joint belt on, which can really be helpful just to give you some stability. I don't mind people using like one of those kind of like elastic bands that just gives you a little bit of support, especially when you're out walking. But I don't want people using like a really intense, thick band around their belly. Because again, even though you're pregnant, you still should be working on your abdominal muscles. So take that with a grain of salt. Obviously, if you need a little bit of support for long walks, if you're on your feet for a long time, that's great. But we want to make sure we're not wearing it like all the time. They usually aren't very comfortable when you're sitting anyways. So that's just another thing that could be a little helpful tool during your pregnancy. All right. Hopefully that is helpful. I just love helping women during pregnancy get out of low back pain, pelvic girdle pain, because I know how horrible it is. And I want you to enjoy your pregnancy, to be able to do the activities and the fitness and the athletics that you love. And so if you need any help, I do consultations, right? So feel free to reach out. I am arguably too accessible on Instagram usually. And also that pelvic pain fix plan is there for you if you need, especially if you're not able to get in to see someone or you have other kids and it's so hard to get in for an appointment. Even if you do have a provider, that can be a really great tool to help you fix some of these things on your own at home. All right, strong moms, until next time, I so appreciate you being here. Be sure to take some time for yourself this week. And remember that even though some of these pains are common, they are not normal, and there is always something that you can do. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.